At times you feel alone, but once you start using, a lot of times you just give up and you just feel like there's no hope.
Dressed in a faded green inmate uniform, Travis Orrin of Columbus sits in the Pickaway County Jail. He was arrested for not paying child support, but Orrin has a much bigger problem. For 7 years, he's been addicted to drugs. It started with prescribed pills and led to heroin. And while sitting in jail may look like a grim situation, this is actually a time of hope for Orrin. That's because the Pickaway County Sheriff's Office has a program that connects addicted inmates with treatment, using the medication known as Vivitrol, which has been proven to help opioid addicts.
Yeah, they definitely know there's a problem out there because a lot of times the same guys in and out, but now they're starting to get, like the Vivitrol shot. They're trying to send them to programs so that, they don't come back because it's just a vicious cycle.
Lieutenant Gabe Carpenter leads the program. Not only are inmates connected to treatment, but a deputy drives them to the doctor immediately after they step foot out of jail.
Because they're faced with that question once they leave, oh my gosh, that craving comes back immediately as soon as the clang of the door. And they know they want it, and so we got to try to cut that part of it off to give them a little bit more support out the door.
This way of thinking is not just happening in jails. It's in hospitals, where medical personnel try to identify addicts through a screening process, then connect them to treatment. It's also in courthouses, such as the Hocking County Courthouse in Logan, where there's a special court docket. Addicts can plead to a lesser charge in exchange for joining the program. These types of measures go by many names, such as integration, coordinated care, or perhaps most commonly known, intervention.
Treatment is extremely important, and it's really important to find people who need treatment where they are.
Joshua Sharfstein is a director of the Johns Hopkins University's Public Health School. He's done extensive studies of what different states do to curb the opioid epidemic. According to Sharfstein, states with robust intervention programs are starting to turn the tide in the battle against opioids. But he says jails, and especially hospitals, can do even more. Researchers from Yale found that the success of a treatment program can double if doctors administer that medication assistance, such as Vivitrol or methadone, in the emergency room.
Unfortunately, many hospitals don't offer that kind of treatment, which is kind of crazy if you think about, well, if you had a treatment that you could provide for diabetes in the emergency department, well, you'd expect every hospital to do it. And in fact, every hospital does do it.
The state has started to recognize the important role jails, hospitals, and courts play in intervening. Last year, Ohio's prisons enrolled 15,000 inmates into Medicaid so they could receive treatment once released. Special court dockets around the state, including Hocking County, helped more than 940 people get treatment and other services. Lori Chris is with the Ohio Council of Behavioral Health and Family Services Providers. They represent the groups that deliver treatment. She says providing full, comprehensive treatment that actually pulls people out of their addiction requires every gap to be filled.
So when a person is motivated and they have the capacity to take advantage of the opportunity of treatment available to them, then that's the time that we need to make sure we're engaged with them. So having law enforcement and hospitals know that the person's at a critical moment and connecting them immediately to behavioral health services is critically important.
Back in Pickaway County, Carpenter says law enforcement have taken a hard look at their role and reevaluated what they should do to help people who may initially seem like criminals, but are also people who need help.
It's a win-win for me because not only are they getting help becoming a productive member of society, but I don't have to see the revolving cycle. We're trying to break it, and right now that's the best way that we can do it.
The same reevaluation is happening at hospitals and courtrooms too. For Travis Orrin, he has seen the light of sobriety and felt the pain of relapse. But with his new treatment on the horizon, he feels this might be his way out for good.
There's hope out there. Just stay focused. If you go to some meetings as soon as you get out, if you're in jail or you're incarcerated, first thing I'd do would be go to a meeting, get a support group, get connected, and just stay motivated, and it gets better. It really does.
Andy Chow, State House News Bureau.